now I'm really excited to introduce our three guests. So we've got Kim Rees, who's the Early Years Coordinator at Brotherhood of St Lawrence. We've got Diane Basser, Team Leader of Merry Kids at Merry Health. And we've got Nicholas Kalikia, the Mental Health and Disability Engagement Officer at Carer Gateway. And we're going to hear from them one at a time. And yeah, as I said, you can start putting questions in the chat and we'll have a bit of time for question and answers at the end. But first off, I'd like to introduce Kim to talk first, and I'll share your slides, Kim.
Okay, great. Thank you for that. So good morning, everyone. My name's Kim, and I'm an Early Childhood Early Intervention Coordinator with the Brotherhood of St Lawrence. And so I'm just going to give you a bit of an overview on the Brotherhood of St Lawrence and the NDIS, and then there'll be a chance to answer some questions that you may have at the end. Okay, so the Brotherhood of St Lawrence is an NDIS partner in the community, delivering the NDIS and early intervention support to children aged 0 to 6. So the early childhood intervention approach is designed to support children aged 0 to 6 who may have a developmental delay and children who have a disability. So what will happen is you'll initially fill out an online referral form, and then you'd be booked in to have a meeting with an early childhood coordinator who will discuss your concerns that you may have about your child and support you with some different pathways that the Brotherhood can help you with. So the three main pathways of support that we can support you with may be linking in with the community and mainstream supports. So most of you have already done that today, being linked in with Merry Health. So it could be things like the community health, your GP, paediatrician, play groups, peer support groups, childcare, kindergarten, schools, all those sorts of mainstream supports we can assist families with. We also offer our Early Connections program. So that is where you would work with the coordinator for approximately 6 months and would support you with strategies for your child to support their development. And the third option we can help you out with is accessing NDIS funding. So they're the main sort of avenues of support we offer with the Brotherhood of St Lawrence. And so to access these supports, your child does not have to have a diagnosis. There is another avenue that we label as developmental delay, and that would get support as well. So if you were looking at, I think I'm up to like slide 4 now, I've jumped all around. If we're looking at the eligibility requirements for the NDIS, firstly, you would need to be under 65, which for children, it would be under 6 years of age for children. You'd need to be an Australian citizen, permanent resident, or hold a protected special category visa. You'd also need to meet either the disability requirements or the early intervention requirements as set out in the NDIS Act. So I'll talk a little bit now. So developmental delay is how we would access under early intervention. And so that would be for children aged under 6 years old can access NDIS through that pathway. And that's where we'd have a chat in our initial meeting and try to determine if your child would meet that criteria. So it may just look like you have concerns about your child's ability to communicate. So it could be a bit of a language delay where their vocabulary is quite minimal. They may be difficult to understand, those sorts of things. So we'll discuss that with you in more detail once we have our... and I guess, once to get the whole sort of process started, what you can do is just log on to our Brotherhood of St Lawrence website, and that's where you can access the referral form. There is a link that you can click on and you can fill that form online, and that will get the whole process started. So that's a bit of an overview there, and I'm sure there's probably lots of more specific questions that you all have. And the last slide there has just got some contact details. If you'd like some more questions answered that I'm not able to today, there's all those details there for you to reach out to. So I'd recommend the 1300 BSL ECI line, because that's the early childhood space, and they'll be able to help you out with the referral forms and those sorts of things. So that's a bit of an overview there. So I might leave it there, quite sort of just brief for now, and then we can open up to questions at the end. Yeah, all right, thank you.
Great, thanks for that, Kim. I think that was a really good place to start. And now I'm going to invite Diane to speak.
Sorry, I couldn't find my unmute button. Thank you for inviting me today. Lovely to be with you all. So I'm the team leader of the Mary Kids Early Intervention team, and we are based in Preston now, recently having moved, and we work with children. So once the child has an NDIS plan, we can then actually start to provide service, therapy service or support to the family. So we work with children 0 to 6, again, or to the end of prep, supporting the child and also the family with therapy and networking for families into services that will assist them to deal with the situation that they find themselves in. So in our service, we have physio, occupational therapy, speech pathology, and also an early childhood teacher who's at the moment seconded to another area of Mary, but hopefully will come back. So once you have your NDIS plan, what we would tend to do is people either self-refer into our service or are assisted by Brotherhood to find services that might be appropriate for them. We would meet, we have a community engagement coordinator who would talk with the clients through the process of starting with Mary Kids. So generally we would meet, have a bit of a meeting about what your goals are for your children and devise a bit of a draft plan around what sort of services we can provide. So that can involve one-to-one therapy. It can involve some small group work. Certainly during COVID, we've definitely done some telehealth groups because it's been much more difficult to access people in their homes or childcare centres. So the way that we work is a place-based service, which means we come into your home, we go to kinders, we go to childcare, and the evidence around early years therapy sessions is that having sessions either in the home or in the place where the child feels most comfortable and natural is the best service to offer. We also work under a key worker model. So we have one person who's allocated as the key worker for your family, and they essentially coordinate the therapy services. So you might come to us saying that you really require some speech pathology services, but we might not actually have a speech pathologist who's available to be the key worker for you at that time. You might then end up with, say, a physio or an OT as the key worker, but they will liaise with those other professionals, and sometimes it involves doing some blocks with that other professional. But, you know, just that the advantage of having a key worker in a team which contains various disciplines is that they can coordinate and help you to map the service that your child might need. So, you know, a lot of the people that we've worked with under their NDIS plans, we've been working with for 3 or 4 years. So often it's quite long term. And the thing that we really stress is that it's not about the therapist taking your child away, making them better and giving them back. It is a process, a longer term process of teaching you how to work with your child to gain the most and get them to reach their maximum potential of development. So it is a train-the-trainer model, effectively, that we would be training you to work with your own child, which again is evidence-based that that's the best way to work with young children in this sort of sector. And basically the theory we have is that most of the therapy occurs between the sessions, not actually in the session. So contrary to previous ideas with therapy where people felt very relieved if they got in to see a therapist and could go to weekly sessions, and it kind of absolved people's guilt about doing stuff for their children. This is really about saying, you know, that there's a partnership between the therapist, the family, the school, or the childcare, whatever, to be working with that child. So we do a lot of liaison with agencies like kinders, childcare, schools, helping children to transition into that first year of school. So it's a real partnership, I guess. And so what we would do initially is we would sit you down and say, okay, you have X amount of dollars through your NDIS plan. how would you most like to use this? Do a little bit of a draft around, these are the goals you have, this is potentially what we can offer for this period of time. And we would be reviewing those goals about every 3 to 4 months. So it is really a collaboration and a partnership between the organisations and the family. I think that's probably enough to start with. And also, it's not just about the identified NDIS participant in terms of the child. It's actually about supporting the whole family. So it's about saying, we want to help you as a family to move forward, because often when families have a child with a disability, there's very significant issues with other children or other people within the family, because a lot of attention goes to that child with the disability. So it's really about looking at the whole family and supporting them. And if you were being referred in and getting services, say from a physio, that might involve some giving you advice around some exercises and some mobility tools for your child. But it may also involve things like prescription of wheelchairs or seating aids, or ability to actually be well positioned for play. If you're going to get some speech pathology, there would be lots of advice around, can your child receive the information that they're actually being told, and can they process that? Can they express themselves well? Speech pathologists also work on issues like feeding, fussy eaters, swallowing issues, different forms of communication, so communication aids. And then the occupational therapists might work on functional activities. So if your child was having issues with activities of daily living like dressing and bathing and organising themselves, holding a pencil, doing basic jumping, skipping, hopping, concentrating school kind of activities, is all that sort of stuff that the occupational therapist might be involved with as well. So again, really stressing that team approach and there's lots and lots of liaison between the members of the team around a particular client. So very team approached service. I think that's probably enough for this moment, and I'm happy to take any questions.
Great, thanks, Di. I think it was really great to hear about the team approach, but also that the whole family is supported. And I think that leads quite nicely into what Nick is here to talk about in terms of carer services. So I'll hand it over to Nick.
Thanks, Kat. I'll just share my screen. Just give me a thumbs up if you can see that. Thanks. Great. So yeah, as Kat said, it does lead nicely into what I'm here to talk about, which is basically who a carer is, what supports are available to carers, and how to access those supports through Carer Gateway and Mirror Carer Services. A carer is somebody who provides unpaid care and support to a family member, loved one, or friend with disability, mental illness, chronic health issue, or age-related condition. We work with carers from all different walks of life and from all different caring situations. So we know that becoming a carer can either be gradual or it can happen suddenly. We also work with carers under the age of 25, which we call young carers. We acknowledge that all caring situations are different. We work with some carers who might help a family member or a friend or loved one for maybe a couple of hours a week with grocery shopping. And then we also have carers that look after somebody 24 hours a day, 7 days a week. Just to give you a few stats from 2018, we will update these stats mid next year when the results from the Australian Bureau of Statistics come out. But in 2018, there were 2.65 million unpaid carers across Australia. In Victoria alone, there were more than 730,000 carers. No surprises that 70% of these primary carers are women, and more than 162,000 were over the age of 25, and 10% of Victorian carers are under the age of 25. So it just gives a bit of perspective as to the numbers there. Why do carers need support? None of this will come to a shock to anybody. Some of these stats and figures, the research shows that being a carer it means that you are 40% more likely to suffer from a health condition yourself. The caring role can be extremely emotionally taxing and physically draining. We know that 50% of primary carers can be on a low income, because obviously the extra costs of caring can be enormous, and it can be very hard to cover living expenses. We want to recognise and celebrate carers. We know that carers are a vital contribution to society. We know that carers do what nobody else can do. And we also want to give carers the opportunity for personal growth and developing new skills. Carer Gateway was launched in April of 2020. It's a national government initiative. It was launched by the Department of Social Services. So Mary Health here in Victoria are the leading agency, and we work with 7 other providers that deliver the services no matter where you live in Victoria. So we manage the statewide delivery and the central intake and registration, and Mary Carer Services provides those services in the Northern Metro region. So if you just quickly have a look at the map on the left-hand side, in the purple at the top is the regions that we cover. Now I can also now share that we are actually taking over the services in the west. So in the green where it says Carers Vic, we're going to be taking over those services as of the end of this month. And then we also work with Uniting Vic Tas and Alfred Health. And on the right-hand side is our regional and rural partners. But as I mentioned before, it doesn't matter where you live in Victoria, you can access the support through the ways that I'll talk about in a minute. So these are the 7 LGAs that we work with in the Northern Metro region: Yarra, Banyule, Darebin, Moorland, Nillumbik, Whittlesea and Hume. Those numbers were taken from the ABS census of 2016, so I will update those as soon as we get those new figures as well. What services are available? We have, you can access in-person and online peer support. So that's an opportunity to meet other carers and share lived experience. That can be in the form of meeting for coffees, for lunch, whatever that might be. We also run a lot of online and in-person activities and events such as cooking classes, singing groups, just to name a few. You can also access 6 free sessions of carer counselling to talk through whatever that might be in terms of emotional health or the caring role. You also have access to carer education, training, events and activities to learn practical information and advice. We can invite you along to any of our information sessions to learn more about that. As mentioned before, we have carers under the age of 25. We run a Young Carers program, which includes engagement with local schools and one-on-one support. On top of the carer counselling, we also have health and wellbeing coaching. So you can access an additional 6 sessions to receive advice on whether it might be nutrition, physical activity, stress and mood, or management of chronic health or disease. We also have a dementia carer consultant, and you can also access Respite. So we have both home-based and out-of-home care respite. That includes personal care, domestic care, such as cleaning, and there's also residential respite, so access to the community activities and transport. Available 24 hours a day, 7 days a week is also emergency respite for those situations where you do need immediate support. As well as the in-person and phone-based services, we do have online services. So there are peer support groups online as well in the form of an online carer forum. We also have self-guided coaching sessions and skills courses. So you can access those through the website at any time. They are completely self-paced and self-timed. There's no obligation to complete them. You can kind of go on at your own leisure and learn a new skill, whether that might be how to get a better night's sleep, how to manage stress, or how to eat healthier. Those are just some examples. You can also access the phone counselling as well, and that's nationwide. So that's a separate service that you can access through the 1-800 number. The eligibility is pretty broad, as long as you are a carer to a person with disability, mental illness, chronic health issue, or age-related condition. That also relates to somebody who's frail due to age. Your caring role must be ongoing or likely to be ongoing for at least 6 months. However, that does not apply to palliative care. We can also provide support where a person's caring role has ended or recently ended, has recently ended. The only real kind of eligibility requirements is that you can't be paid or employed by the care recipient. So you can receive government support such as carers allowance from Centrelink. That's completely fine. You or your care recipient can also be on NDIS or My Aged Care or any other mainstream services. That doesn't affect eligibility either. And we also do not require permanent residency, citizenship, or visa requirements. So we can work with people who aren't permanent residents. We can also work with asylum seekers and refugees as well. I'm not going to cover this slide in too much detail, but this is just a bit of a snapshot of what to expect. It is not as complicated as this makes it seem. The first two columns are basically the intake and registration process, which happens here at Mary Health, which we talk to you about your eligibility. And then we move into sort of the understanding and planning and coordination phase, which is done by somebody, which is called an assessment and planning officer, which will talk to you about your priorities and where you are in your life and what needs you'd like to kind of work on. And then we look at creating referrals and booking services and then providing the delivery of the service. So this is a 12-month program, and we do a check-in at 6 months to see how everything's going, and we can always change services depending on the carer's needs. So it is a real case-by-case, person-centered approach. When you do register, we have a conversation with the carer about where they're at. So we look at the 7 life domains listed here on the screen. So we sort of give a kind of rough guide as to where the carer's at. Sort of a 1 or a 2 would be that the carer is really struggling in that area of their life, and a 4 or 5 sort of meaning that things are still going okay in this situation. This is done again after the 12-month mark and to see if and how a carer's situation has improved, and if not, we can have a conversation about where to from there. To access services, there are 3 ways to do this. The first is through the 1-800 number, which you can call between 8 a.m. and 5 p.m. Monday to Friday. There's also free interpreting services as well if that's needed. As I mentioned before, the emergency respite operates 24 hours a day, 7 days a week. So you can call that after hours, and you'll be triaged to a different service. We also do have a callback service, which I do recommend for people who might be, time poor and don't, you might not have time to wait on the phone or to make phone calls, which is completely understandable. In that situation, I would recommend going to the Carer Gateway website to the request callback, fill in your details there, and somebody should give you a call back between 24 and 48 hours. If you would like somebody to complete a referral form on your behalf, such as an allied health professional, a GP, or somebody in the community, that can be a community service worker, then they can fill out that referral for you online, and I can send that link out as well to anybody who you might want to fill that out for you. So we try to make the process as easy as possible. Now, I'll share these slides with Ndis and Kat, so they can send these out. So I thought it was important to include the Mary Carer Services number if you do have any questions. I will also give in my number and email. If you want to reach out and ask me any questions, I'm more than happy to answer them. Just before I finish up, one of the programs that is recommencing in January is the Carer Support Program of Moorland. And the reason this program came about was because after the LEAP program, which Ndis mentioned before, what we noticed was there were a lot of parents of children with additional needs who still wanted to remain connected somehow to either Mary Health or with each other. So we designed this program for those families to be able to remain connected with other parents in similar caring situations, And we also wanted to provide a safe space where people can share their lived experience and also access other health services. So this is more a peer support program where carers can learn from each other, but we can also provide information from other healthcare professionals from within and outside of Merri Health. So the program will recommence on the 11th of January, and they'll be happening in Faulkner monthly. And if you would like to register, I've got my number and email address there, so you can access that information and you can give me a call. Thank you so much. We'll leave some questions till the end.
Thank you, Nick. That was really great. And we do have some questions coming through. So we've got one that's come through for Kim. Kim, what is the current wait time between referral and planning meeting, and then between the planning meeting and receiving the plan?
Okay, so a tricky one to answer, unfortunately, without a set time frame, really. So at the moment, it's pretty much, there is a long wait list. We've had a lot of applications, so it's pretty much as soon as possible is the answer. So I can't give a definitive timeline, but as soon as the team is able to get to your query, then it will be answered as soon as they can. Yeah, and typically what would happen is once the referral is received, someone from our bookings and intake team would send you a message to let you know we've got your referral. Then the next step would be that you'd get contacted by them to book in an initial meeting. So that's where you'll get to chat with the early childhood coordinator about your concerns. And then that's when they'll decide what pathway we will best support you with. And so if that would be our early connections program, or maybe putting in the access request to NDIS. And then again, there would be another wait time in between that, getting that planning meeting. And then after the planning meeting, we're going to write up a report and submit that, and then you would get the NDIS funding available to you if you were eligible. So it is a bit of a wait and a lengthy process, and it varies a lot. So I've been advised not to give anyone answers because it does vary case by case, unfortunately. Yeah, but there are sort of the three main steps that you would go through in that process to get to that point. Yeah. So thanks. Sorry, Nick, but I know you were wanting a more specific answer than that, but it does vary a lot. Yeah.
Thanks, Kim. I thought that might have been a bit of a tricky one. But we do have another question that's also, I guess, about waiting lists and times. And someone's asked if Di can talk about, so in the northern suburbs, there's quite a long wait list for speech therapists and occupational therapists. And yeah, there's just some services now aren't taking any more people on waiting lists because they're quite long. So, and if someone's plan is expiring in March 2022 and they haven't really accessed any services yet because of the waiting lists, do you have any advice around accessing services or any other supports that might be there to, I guess, fill a gap?
Oh, is it for me?
Okay. Oh, sorry, Di.
Yeah, someone's directed it to you, Di.
Okay. So we actually did have a waiting list, which just became a bit ridiculous. So we actually stopped having a waiting list. And we really, at the moment, we don't have we have probably about 5 people on the waiting list, but that's mainly because we were servicing sort of 0 to 9 or 10 years, and the board at Merri has made a decision to actually reduce that age group, and we're now going 0 to 6 years or to the end of prep. So that's actually made a bit of a difference, because what we were finding before is the wait lists are often long because services actually service people for a very long period of time, and we actually do have a fairly high retention rate of clients. So we could have clients that have been with us for 10 years really. And that there was no real throughput of new people, which was really difficult for people trying to refer in with young children. So the decision has been made that we will now cut back to 0 to 6 years or end of prep. So waitlist times, yeah, it's just the last few years has been really, really difficult. There's a national shortage of speechies and OTs, particularly OTs. we've actually been trying to recruit, and we've probably had about 4 lots of recruitment rounds with no applicants. There's, it's across the board. There's just a huge problem with recruiting allied health. So look, in terms of wait lists, what we would do with people is we would try, if people were on a waiting list, our community engagement person would be continually contacting them, probably about once a month, actually talking through what the situation is, trying to support them in linking them in with other services, and that could be the Carer Gateway or other affiliated services for, it might be parent support groups, affiliated services for children with disabilities. So, and the other thing that we have thought about for next year is potentially having like a coffee morning for people on the waiting list, which would be a Zoom sort of meeting that we would present different topics once a month, like from a speechy or from an OT or from a physio or whatever, to people that were on the waiting list, just to help support people while they were waiting. So that's something that we're going to try and look at next year. But yeah, the waiting times are really, really problematic, and I know it's very frustrating for families. But having said that, if we were working with someone on our waiting list, we would try our best to give them information about private providers in the area, other agencies to try. So we would be actually advising people, we've heard that there's a vacancy in this place, why don't you give them a call, or, really trying to network people into various services around the area. And I guess, Kim, the other part of that would be if they are actually nearing the end of their plan and they haven't been able to access services, our understanding would be that, they would have that discussion with the NDIA and give a reason as to why they haven't been using their funding, and that would be looked upon favourably. Is that correct?
Yeah, that's spot on. So it's not going to affect your new plan that you have. The NDIA will take into consideration that there are very long wait lists, and a lot of families are not able to access those supports at the moment due to that. So that will not affect your funding for the next plan. Yeah.
And I guess the other thing about waiting lists is don't give up, because certainly, we've just opened up 6 places because you never know when vacancies are going to occur within a service. So for instance, recently we've had people exit the service because they've moved to regional Victoria or whatever. Now, we couldn't plan ahead for that. That's just something that's happened. So we've suddenly had this opening of about 6 places. So we've been able to fill that quite quickly. But for whoever asked the question, if you wanted to give us a call, I'm sure we could help you to sort of give you an idea of other potential services, or we may have provision to pick up a couple more people. So I would say, give our community engagement person a call or send through an email to our NDIS website. I also have information that I will give to Kat to distribute to people after the session. So it'll have the phone number and the email address as well. So just to give you some written information around the service.
That's great. Thanks, Di. I think, we'll send out an email afterwards that has all the different information that Nick shared, that Kim shared, and those details from Di as well. We've had another question around, again, it's come about the waiting list, around they were trying to get speech pathology through Merry Health, but there was no availability. So they've gone private, which is a bit more expensive. So they're wondering if they're eligible for NDIS funding. So maybe, Kim, can you remind us a little bit around what's the eligibility and where those first steps are to find out?
I suppose so. The very first step would be filling out the referral form online and booking in that first meeting with one of the early childhood coordinators. And they're going to have a chat to you and support you through that process. And they'll determine if you meet the eligibility requirements to receive the NDIS funding, or if there's other ways we would best be able to support you. Yeah, so I guess if we're looking at it for children aged under 6, you can access the NDIS funding through what we call as developmental delay. So you wouldn't need to have a diagnosis of a disability of any sorts, But once a child does turn 6, to continue on receiving NDIS funding, they would need to have a diagnosed disability that we would update in the system. So I hope that sort of answers that question.
I think the other side of that question may be that they actually tried through the community health stream of Mary. And there is quite a long waiting list there, but I guess my advice there would be to stay on that waiting list. Even if you're going private, a lot of people go private, and then when their name comes up on the community health waiting list, they get taken into that service. I think that the thing that some people do not realise is that to be eligible for NDIS, the child has to actually have impairments which might lead to long-term disability. So it is different to the community health program, which is a more mainstream program, and which is well, often just the child might need a bit of speech or a bit of OT, or so the NDIS is actually has different requirements for eligibility. But I would say definitely in terms of the waiting list for the community health service, stay on the waiting list, because yeah, if you're not on it, there's no chance of you being picked up. But you know, it's a good backup even if you are going private. And you can always reapply to that community health waiting list at any time, but they do stop at school entry. So the earlier you refer, the better.
Thanks, Di. I think that was helpful to clarify as well around the different Mary Health, the community health part for allied health as opposed to the NDIS part. And yes, they'd asked, should we reapply to the Mary Health waiting list? And I think you're definitely saying yes. We also had a question around, Kim, can you tell us a little bit more about that Early Connections program and what it looks like?
Yeah, sure. So that program we'd offer to children that would have more of a developmental concern. So if your child wouldn't meet the eligibility criteria under developmental delay, that's when you'd be eligible for that program. And so what that would look like is you would work with one of the coordinators with the Brotherhood of St. Lawrence, and we would catch up sort of about once a month for 6 months. And so the aim of that program is to support parents and build their capacity with parenting and supporting their child. So we might look at more sort of daily routines in the home and look at what's happening there. And then together we would come up with some goals that you'd like to see some support with for your child. And that's when we're going to go back and get some strategies and talk to you about those, and then you're going to implement those, and we're going to catch up and keep checking in on how's that going. Has that been helpful to you? Has it not? What sort of support would benefit you? So it would be like a team approach, and we'd be catching up every month to try to support you the best we can. Yes, that's that Early Connections in a bit of a nutshell. But we can also offer other support, like if you're not linked in with the community health, if you needed some advice on a childcare or a support group, a play group, all those sorts of things. So we'll connect you in with all those sorts of community supports as well. So yeah, there's lots of different things we could do together. Mm-hmm.
And further to that, Kim, can we confirm that that's for children who won't be eligible to receive an NDIS plan?
Yeah, typically that's the way it would work. Yeah, if while we're waiting for the NDIS sort of to come together, we could still offer some support in the meantime, so you're not just left on your own. We can still give you some support while we're waiting, because it can be a lengthy process. But it's typically if your child wouldn't meet access, then we'd offer that program for support. And things could change during the sort of program. You could end up seeing maybe a paediatrician, your child could get a diagnosis, all those sorts of things. We might sort of identify that maybe in the initial meeting there was information we didn't gather, and that we feel we could move forward with the application for NDIS. So there's lots of different ways we'd be able to support through that program. Yeah.
Great, thanks, Kim. Another question around how can families prepare for an NDIS planning meeting? I don't know if that's best to you, Kim, or whether Di has any tips. I'm just aware we're asking all our questions to you, Kim.
Yeah, that's okay. It's a big sort of complicated system. So that's why I wanted to keep it sort of quite short at the start and just let people ask the questions that were relevant to them. Yeah, now I'm just trying to pull up, I had it open. There is on our website, on the NDIA website actually, a bit of a booklet with information on that. So that might be a better way, but of course I can't find the name. But I guess basically in preparation for the planning meeting, what you would do in the planning meeting is, again, go over the concerns you have for your child. And the main difference would be that you're going to come up with some goals that you'd like your child to be working on with those different allied health professionals for the next 12 months. So a great thing to do could be to prepare and come up with some ideas of those goals. And then you're ready to sort of have a chat with the coordinator about that and what you'd like the NDIS, I guess, to achieve and what it would look like at the end of the 12 months. So you might come up with goals that, you know, all you want is just for your child to be able to tell you what he wants or needs and express himself. So just to be having a think along those general lines of what you'd like to see as the outcome of getting this support through NDIS. The other thing you could do is maybe start reaching out to some of those allied health specialists. As we know, the wait lists are really long. So while you are waiting for that planning meeting, once you've met access, you could start putting your child's name on some waiting lists. So that way, once the funding's available, you might be a bit closer to getting an appointment with an allied health professional. Yeah. But there is so I was just going to say, if you go on the NDIA website, there's a lot of information there. And there is also a booklet that talks about preparing for the planning meeting.
Just from my experience also with clients that we've had come through that process, I think it's really important to think about the functional things that that child can't do for their particular age group. So I think it's really important for parents to be able to say, look, this child has no idea how to dress themselves, or, you know, I have to help them all the time with things like brushing their teeth, going to the toilet. Like, think about the everyday activities that you might have to help your child with. And this period of time that you spend doing that over and above what you would do for maybe one of their siblings. I think it's really important to have evidence to say, you know, I'm spending all this time feeding my child, or, you know, changing nappies or whatever, which is not something that I should be doing for a 4-year-old. So, you know, to have some really concrete evidence about what you're doing in your day that's taking up your time, that the child, in terms of their normal development, would be able to do, but this child may not be able to do. So just as proof of the support that you might need and the time that it takes.
Yeah, fantastic. I think that's really great way to explain that, Di. Yeah, because we do need to look at, I suppose, what are the functional impacts of what's happening and how that's sort of impacting your child's ability to complete daily living tasks. Yeah, and it can be a difficult conversation because for the purpose of the NDIS funding, we do need to look at what's your child finding difficult. And we know all children are amazing and they all have their strengths and abilities. But I guess, yeah, for this purpose of NDIS, we do look at what are the challenges. So that would be really good to sort of sit down and have a bit of an idea about that one. I was just going to say to Najish, I found that little booklet, so I'll send that to you as an email as well. So if anyone else would like that extra information on preparing for the planning meeting, Najish will have that document there if anyone would like it.
And I think as part of that document, there's actually a bit about daily routines and things. And we often get parents to think through your average day and just go, okay, what are you doing in your average day over and above what you think you should be expected to do or would be doing with a sibling? What things does your family do during the week that this child might find difficult? So think about really concrete things like a timetable of an everyday in that child's life.
So on that, we've just had someone ask, how do you prove that the time spent is over and above the normal, like those activities you're talking about?
I guess it's really difficult because all children are different. But, you know, like I said, you wouldn't expect that you would be changing nappies, say, for a 4-year-old generally. So things like that, or that you would be spending a lot of time doing their activities of daily living, like toileting, bathing, feeding, dressing, all those things for a 4-year-old. So you'd be looking at average development for a child of that age, and then you'd be thinking, okay, most 2-year-olds probably emerging out of toilet training sort of time. You know, most of them would be starting to self-feed, if you know, finger feeding, whatever. So you'd be looking at normal developmental milestones and just going, okay, I think I'm putting in a bit more time and effort than I would be generally for a mainstream child at this age. And some people wouldn't know that. You know, if it's your first child, it might be difficult to know that, but you can always then seek advice from maternal and child health nurses are really good at that, saying, okay, this is child development 101. So this is what you'd expect of a 2-year-old, a 3-year-old, a 4-year-old, whatever. So it's probably not so much about proving it, but it's probably just about, look, I've had to think about this. I've reflected on this. This is my day's activities. This is how much time I'm spending with this activity. More so than proving it, but just actually showing that this is what I've thought about in terms of my days. And, you know, most times if people are in young mums groups or whatever, they're having discussions with other new mums about what's happening with your child, what developmental milestones are they at. So you're kind of getting some idea of like, oh, this is really, really difficult every day, you know, doing all these things for my child. So you don't really need written proof. I think it's just really about actually showing your day-to-day routines and being as prepared as possible to talk through that stuff really honestly and openly. And I know that Kim, as Kim said, you know, sometimes these are really difficult discussions, but to be as honest as you possibly can about that. And I know in the past that there was this thing, I think when NDIS first started, that there was this thing that some of the paediatricians would say, before you take your child to the appointment, you know, don't feed them, make them really ratty, make them act up as much as they possibly can so that you get the maximum possible package that you can. I mean, that's almost like child abuse, really, because it's just so cruel for the children. You know, don't let them sleep, don't let them eat, just take them in their worst possible state. You know, I think if you can really show the amounts of time that you're spending on particular things and talk about the difficulties of every day, you don't need letters, particularly from, because I mean, how is a professional going to know what happens in your household when they're not there? So
Thanks,
I don't know if you would
good to know.
have anything in opposition to that, Kim. Or
No, I think that was brilliant the way you articulated that, Di. That was fantastic. Yeah, I would just add, I suppose, for when you do the initial application, as a parent, you can do that without any professionals filling that out. But once you do get to your initial meeting, the coordinator will ask you what professionals have you been involved in and have you gotten support and gone down the road of the mainstream options available to you. So that is when it would be useful if you've already seen someone at Mary Health, your GP, someone like that, to get them to just write a little note about it. It doesn't need to be an extensive sort of letter or anything. It can just be that they've seen you today and you've raised some concerns, and they can maybe agree, if they do, that they've observed those same concerns, and that would just support and strengthen your case to receive the NDIS funding. But don't let that hold you back. If you haven't done that side of things yet, as a parent, you can just do that referral. And once we do the initial meeting, we can support you with getting any additional evidence required.
Thanks, Kim. I think that kind of goes to another question that was there around, does a paediatrician have to have made the blanket diagnosis of developmental delay before being able to access NDIS, even if a family is seeing speech privately with language delay, suspected autism, and waitlisted for assessment?
Yeah, so we don't need that to be diagnosed by a paediatrician, GP, anyone like that. It is sort of a term that's used mainly by NDIS. So if you were to see a paediatrician, they're more likely to say a global developmental delay as a diagnosis. So it is kind of a bit of a unique term that's used by NDIA because they recognise that it is a really difficult process finding out, is there a diagnosis, is there not? Sometimes there is just a little bit of a delay, and a bit of intervention could mean that the child can sort of catch up and meet those milestones. So no, you do not need to have any formal diagnosis of developmental delay or anything like that. That's something that the early childhood coordinator will support you with. Yeah.
But having said that, like once the child turns 6, moving towards 7, you know, they may not continue to get an NDIS plan if they don't have something more concrete as a diagnosis. So getting into the system is okay, but as you go further into that system, it's important to remember that this is not necessarily guaranteed funding for a lifetime. This is actually, you know, something that we have to continue to work on. And often there is that requirement at that point for proof of diagnosis at 7.
Yeah, exactly. And you'll get a chance to speak to the early childhood coordinator about that. So generally most NDIS plans would be 12 months. And then you would have another planning meeting, which would then be called a review meeting with your coordinator to discuss what's happening with the child. And then the coordinator would also discuss that with you, ongoing eligibility requirements, depending on case by case and where you and your child are up to. So you'll have that support in the process. It's not just going to happen that one day you're cut off. That will not happen. So you'll have that chance to get all that information ready and to explore that further. Yeah.
Great.
Which again, I think is important to actually stress to people, the earlier you refer, the better.
Yeah.
Yeah, and I think that's just come through around with the application. Is there a priority for younger children about to start school, or is it first in, best dressed?
Look, if it's not sort of raised and brought to our attention, it's generally first in and we'll get through them. But if we do see that children are close to turning 6, we will try to prioritise them the best we can, because we know that it's very time sensitive to those children once they're 6 years old. If there's no diagnosis, then unfortunately they're not going to be able to access the scheme. Whereas if we can get you in the week before that happens, then you will get that support even for that next year potentially. So yeah, we do try the best we can to prioritise that. Yeah. So good if you follow that up, even if that was maybe the situation you're in. You could give our intake team a call and just let them know you've put in that application, your child's about to turn 6, can that be prioritised? And they will talk to you about that. Yeah.
Great, thanks for clarifying, Kim. We've got a question that might be for Di or Nick around what's the best resource for finding out about activities or groups that my child with autism can go to improve on being in the community and cope in social situations and different environments?
So I actually sent a direct message to the person that posted that. It's a really good question. And this is sort of just from my advice and experience working in this role and organisations that I've heard fantastic things. So Amaze Victoria are a fantastic organisation that can help link you into some of those activities or groups. I also work quite closely with the Northern Autism Network, which are a closed group of families of children with autism, and they are always hosting events, and some of those events we actually are involved in running as well. So there's some events at the we rock the Spectrum Gym, for example. So there's some really great some activities and holiday. There's a lot of school holiday programs as well. And also there's Sussex Carer Support Group as well, which I would highly recommend. And it's very similar to the Northern Autism Network. It's a lot smaller and a bit more intimate for families of carers. And they can also link you into some of those activities. And it's a really good place to, I guess, meet other families and for the kids to also socialise and meet each other. So that's from my experience of some of the first-hand feedback that I've heard from a lot of the carers that we work with.
And I would agree with that. I think that Amaze has huge amounts of information around resources for families. But I guess from the families we work with, the feedback very much has been the parents know huge amounts about what's out there in the community. So if you can link in with a parent support group, you will get massive amounts of information, and sometimes things that are not on mainstream lists that have helped individual families to cope and have supported people. So I think, that parent link is really crucial often for support and information.
Thanks, Nick and Di. think you've really promoted some good services there. And I can see Nick's just put that in the chat around the ones that he mentioned. So if anyone wants to follow up with them. We've got a question around why is it so hard to get funding for a support worker when the needs for my kid is high? NDIS is so reluctant to provide support for parents of kids under 7. So we've spoken a lot about that younger age group this morning. I can see you nodding, Kim. Do you have a response?
It is, I agree. It is a very tricky one, and it is a definite case-by-case situation there with a support worker. And I guess what the NDIA look at is sort of what are the needs far above what a typical child would need on a daily basis. And with that funding, it is typically more for children with a physical disability. So to get it for other sort of concerns is a bit trickier. And it's not that it can't happen, but it's just about proving where there's that need that would be far above what a typical parent would deal with, because most children, as we know, need a lot of support, and it's not easy being a parent and raising children. So we do really need to look at providing a lot of evidence to prove how is that above what a typical child would need. So not such a straightforward answer, you're right. It is a very tricky thing because I guess looking after a child, we look at it, it's parental responsibility. So that's where we do need to prove that the needs of the child go beyond that. So not an easy one to prove, I agree. Yeah. So that's where I guess being linked in with the other allied health professionals that could support that application goes a long way. So say, for example, if your child does have an NDIS plan, they're seeing a speech therapist, occupational therapist, getting them to make that recommendation holds a lot of weight with the NDIA. If there are other professionals agreeing or recommending a support, then that increases the opportunity. It doesn't guarantee it because we still need, again, just to prove why that's needed for the child, because they look at first, let's provide that therapy support and that allied health support and build the capacity of the parent and the child to live that sort of independent life and increase their sort of daily living skills first. So that's what we'd look at first, and then we would have to look at if that solution has not sort of yielded those results and increased the independence, what other supports could be available. So yes, again, another question where there's not going to be a straightforward answer, and that is the world of the NDIS. It's a complex system with definitely case by case. It varies so much depending on each individual circumstance. So yeah, sorry, that again is not a straightforward answer that you would like, but that's just a little bit of information as to why I guess that's a challenging support to get approved. Yeah.
I think that that's also a bit of a throwback to the old ecosystem where people were given kind of more overall support in terms of like a support worker role. So that's become more difficult now, where more and more people are going to individual private providers rather than an agency like Mary Kids, where they actually work under a key worker model. So with the key worker model, it's a bit like a support coordinator anyway. So you've got a key worker who will pull all the stuff together and help you to access other services within the community. So it's not just therapy. And I think that's why with those children under 7, that the NDIS didn't go down that track of often providing them with a support worker, because the key worker could do that. And that's actually become a bit more problematic as the early childhood intervention services have become full and more people are accessing a speechy from here, an OT from there, and there's not that coordinated level of service that you would get in an agency. So I think that that's also our understanding of why support workers are not prioritised in terms of children under 7.
Thank you. It's good to get some of the background information around why some of these answers can be a bit tricky. And thank you, Nick, for putting all those details in the chat. That's really helpful, and I'll copy that out and put it in our email as well, so that families will have that on record. We had a question come through around if there's someone who's a self-managed NDIS participant and they're already approved, is the carer pathway option available? And are there respite options that can be covered for parents under the plan?
Okay. So I believe Nick did touch on that one before, saying that you could still get support through the Carer Gateway network. Was that correct, Nick? Sorry to throw over.
No, that's okay. Yes, that is correct. The purpose of Carer Gateway and Mary Carer Services is to put the carer at the centre of the support, and we do acknowledge that NDIS doesn't sort of really cover a lot of respite for the carers or for families. So that's where we sort of come in and really try to I guess fill those gaps. So yes, in short answer, we can provide respite. It is a case-by-case sort of situation. Our service is not, I guess, designed to be, lifelong or to be really long-term support. It is really to sort of be more of an intervention and capacity building approach, where we can provide the carer with support that they're really struggling with at that point. But in saying that, it doesn't mean that after the 12 months that you'll sort of just be forgotten. What we really want to do is linkages into some more longer term supports, whether that be through the community or other organisations. We also do invite all of our carers to any events we have coming up, which are free of charge. So for example, in October, we did some events for Carers Week, which was, that's something that we consider respite as well, because it's a way for the families or carers to come along and have a bit of fun. So once you're sort of linked in with us, you'll always sort of be invited to events and activities, and we try to do as many, I guess, fun and respite-based activities as possible. I know some of my colleagues in the peer support program are running, some lunches. So we'll get sort of the carers together and have a bit of lunch. And for the young carer program, for example, we take the kids out to the movies or take them bowling. So I try not to talk too much about all the funding and get bogged down in all of that, because it is really case by case. However, through Mary Carer Services, we are lucky enough to have a bit of extra funding to provide some extra respite through the Support for Carer program as well.
Yeah, fantastic. Thanks, Nick. And I guess what I can sort of end that with is saying, I guess with the NDIS funding, for them to sort of pay for a support, it needs to link directly to the child's disability. So that's where things like carer respite is not necessarily covered by the NDIS, because it's not actually directly related to the child and what's happening there. It's more to do with the family. So hopefully that might give a little insight into why that's a separate sort of organisation that you would go to for that support. Yeah.
Thanks, Nick, and thanks, Kim. A question around, is there help or support we can get for kids with autism attending a mainstream school? Nick, you seem to know a lot of different services. I might see if you have an answer.
Yeah, well, I mean, probably repeating myself here, but I think AMA's actually really good at advocating for that type of support as well. I've heard that, and I'm sure people have probably had different experiences, but they are able to sort of help with some of those, I guess, supports and advocacy around that. I always sort of do refer to AMAs because they are the main peak body in Victoria for autism. So they do have different avenues and different, I guess, advocacy services around that. So I'm always sort of suggesting to sort of start there, and then, they might be able to lead you in the right direction. But I do know that they provide a lot of advocacy around that, and a lot of resources and information.
There's another one that's a more broader, I guess, organisation, which could be the Association for Children with a Disability as well. So they will advocate for children with a disability or developmental delay. So they could be another good place to connect.
Yeah, they are amazing. They do some really fantastic work, and they do focus a lot on education. So that's a really good one. Thanks, Kim.
The other thing that we're actually currently investigating, because we're in the process of transitioning out the children that are 7, 8, 9 years old, is we have made links with an organisation called Ali Assist, which is a private organisation, but they employ students, so allied health students, under the supervision. So if you have a private speech or a private OT or whatever, Ali Assist can often link you with a allied health student who can then work towards achieving some of the goals on the therapy plan, which has been written up by the speech or the OT or the physio, whoever. So what we're finding is with a lot of parents with sort of school age kids as they're getting older, they don't necessarily need intensive therapy as much as someone to follow through on the therapy goals that the therapists have written up. And to, in that case, also potentially give some respite to the parents. So it might be taking the child on public transport, teaching them how to use, money, ask how much things are, handle money, all those sorts of really functional everyday activities. So we've had quite a bit of success actually having people matched in that scheme. So there's a few organisations like that. There's Higher Up and there's Mabel and there's Ali Assist, but the premise is that you will have a therapist that oversees the program that these students can then deliver. And the advantage is with the school age children, what we found is really difficult is everybody wants appointments at 4:30 on a Tuesday afternoon or whatever. There's just not enough therapists within agencies to provide those services. So, if the therapist has written a program, then the Ali Assist people, because they're university students training to be therapists, they can often do out of hours work or weekend work with families, which is hugely beneficial for a lot of parents where they're just feeling completely overwhelmed by the need to continually be available to their child. So we've had quite a bit of success with some of those agencies as well. I think it's worth looking into. And, some of them are really good at matching the participant and the therapy assistant. And can do some amazing work with, these kids. So, I think it's worthwhile, particularly for the school age kids, looking into those sort of organisations.
Can you say that name again, Di? And would that be something, how would people link into those agencies?
They have to approach them individually. So they all have websites. Ali Assist is ALLY, ASSIST, so Ali Assist, so Allied Health sort of. Higher Up is HIREUP. Mabel is Mabel. It would be a matter of going onto the websites. I mean, we're not promoting any of those services in particular, but certainly there's more and more of those agencies popping up. So, have a look on the website. Ali Assist has a really amazing website and they actually step you through the process of how to access their services. So, yeah, have a look on their website.
So for parents to access Ali Assist, they would go on the website and make contact themselves.
Yeah.
Thank you.
So just on that, there is another company, Everyday Independence, that offer a similar service, and they call it their habit coach and allied health assistant. And that, if you had an NDIS plan, you could use your funding to pay for that as well, which works out a lot quite often than the therapy bills. So it can be a really great support for families.
And I can see someone's put the link to Ali Assist in the chat, so thank you for that. And we'll include it as well as the other ones that Di and Kim have mentioned in the notes that we'll send out. Oh, and Kim, that was Everyday Independence, is the one you said?
That's right, and they call it a habit coach.
Habit coach.
Yeah.
Great.
So the way we've seen it work really successfully is, so one of the private OTs that I'm familiar with, she got someone from Ali Assist to come in and to the household every morning. This family had 3 children on the autism spectrum. So this particular student worked with one of the children, helped them to, get out of bed, get dressed, was just really somebody supervising the child to do that. They learned how to make their own breakfast, and then the reward for that was if the child was successful in doing those things, then together they would take the dog and walk the dog to get the child to school. And then the alley assist person would go off to university. So, you know, something really simple like that, but it was amazing. It made an amazing difference to the functioning of that family and to lowering the stress levels of those parents. So, you know, it's really practical everyday assistance, which what we're finding is most parents that have children with disabilities, you know, over time, it's like really what we mostly need is someone to take the child to the park and, you know, follow through with maybe some speech goals or whatever, you know, take them to the movies and look at recreation pursuits that might be useful, rather than intensive, like we're going to sit down at a table and work on articulation or whatever. So, you know, as children get older, that's what we're finding the parents are actually really wanting. They just need a break. They're exhausted. So I think these agencies are really providing a great intermediary in that process. Not taking away from the need for therapy, but it's actually working alongside therapists, which I think is fantastic.
Great, thank you. We're nearly at the end of time, so I've got one last question, and this one will be for you, Di. Can we join Merry Kids if we already have a speech therapist and an OT on board? And can we access other services provided by Merry Kids?
Yes, it depends on the age of the child and it depends on our waiting list at the time. But what I would say is that often parents think that the more the merrier. So like if we can get 10 therapists on board, the child will improve more quickly. But in fact, it's actually really, really confusing. So if you've got two OTs or two speech therapists, it's actually really confusing because they may be saying slightly different things or they might be working on slightly different goals. And it's also really frustrating for the therapist to have numerous of the same discipline. So, and also I think that child would not be prioritised on our waiting list if we knew that they had other supports, because there's so much need out there in the community and there are a lot of people with nothing. So yeah, I mean, it would be a conversation, but I would be trying to avoid having multiple therapists for the same discipline because it is just really confusing. But it doesn't preclude you from actually, you know, making an inquiry or coming on board. I guess the other services that we offer are very much around that person having that key worker. So, you know, they could still access, if we were running some groups, absolutely. We could, you know, the sorts of groups that we've run, school readiness groups, music groups, school holiday science groups, those sorts of things. There would be no problem about referring, particularly if there was those sort of groups happening. But in terms of having multiple therapists of the same discipline, I would really try and caution you on that.
Yeah, and there's kind of come through with a clarification on that. So they might have speech and OT elsewhere, but if they needed physio, for example,
Sure.
Could they come to Merry Kids?
Sure. But again, I would say that our real focus is on that key worker. So, you know, when people come and say, I just want 7 hours of physio or I just want 10 hours of speech or whatever, it's really messy in the way that we actually run under that key worker model. But yes, particularly with physio, because we do have a physio now 4 days a week. So, and I know that that's a service that's not commonly available in some of the early childhood services. So yes, that would be. But in putting forward the inquiry, make sure you specify, because you would actually have more chance of being picked up if you said, you know, we just need physio at this time, then yes, that's possible.
Thanks, Di. So we're getting some comments through saying thank you, Kim, Di and Nick, for all the information that you're providing, and it's been really useful. And we've answered all the questions that have come through, sort of except for one, which was how can we get invites for future sessions like this? And that would be by subscribing to our Ready, Set, Prep newsletter, and I'll put the link in the chat where you can subscribe to that, as well as following the Merry Health Facebook. And Nazish, do you want to talk about the WhatsApp group?
Yes. So we do have a Ready, Set, Prep WhatsApp group for parents, mainly from Northern Moorland area. You are welcome to join that group to get updates about Ready, Set, Prep activities and initiatives like this workshop. So if you're interested, please send me an email or just send me a text message and I'll add you onto that group. But this is one of the sessions, it's like a very new session we've done. We haven't done an NDIS specific session before. It's the first time we've done it. So if you've got any feedback about today's session, you can either put it in the chat so that, we can improve in the future. It really helps us. And you can also email us later as well if you think of something that we could have added in today's session or could have made it better for you all. But thank you so much for joining today, and please stay in touch through our newsletter, through our WhatsApp group, and through email and other parts of communication.
And thank you again to Nick, Di and Kim. There's been so much information that's been shared, and we're really glad you could come along and spend the time with us this morning. And thank you everyone for coming along and spending your time with us as well. It's been really lovely this morning.
No worries. Thank you so much.
Thank you.